Okay, so we can go ahead and get started. See that it's 7 o'clock according to mine. So welcome everyone. Let me get back to our normal slideshow. Hopefully I'm sharing that so everyone can see it. We are recording this. So my name is Ben Porter. I am one of the teaching faculty here at UT Dallas in the Bioengineering department. And I am helping to organize our summer series. So this is the second one of our events over the summer. It is what is biomedical engineering and what can I do with a degree in it? We do have two more coming up. We'll remind you again at the end of the talk. One is coming up on August 10th. That is about campus resources that are available to you that we probably don't know about, that you might not have heard about or in orientation. Why is it moving forward? That was not supposed to be automatically moving forward. Hang on. Thought I had it going so well, man. That's supposed to be timing. But sorry, as I was saying though, our next one on August 10th is about campus resources that are going to be available to you that you might not know about. So it is definitely worth checking out. And then on August 19th, we actually have an in-person um, workshop, a boot camp that we will be doing on campus. Um, and that one is going to focus on developing your college skills. Here we go. Developing your college skills, your study skills, your organization skills, everything like that, that we expect that you probably already know, but you might not know. We want to make sure that everybody's up to speed and ready to go. So that is what we're going to focus on there. There we go. So that's that summer welcome series. At As On Campus, we will be providing lunch and we will also be giving away t-shirts. We'll be sending out a registration form for that tomorrow. So keep an eye on your email for that. And it should be really good. So we'll have lots of different speakers and we'll keep it interesting. And even if you already feel like you know how to take notes and do a good study plan and all that, it's still good to come to and get different strategies from other people. See what they're doing, understand that, and just kind of get an expectation of what we think you should be able to do coming into college as far as your study skills go. So for today, this is our basic schedule. So we are going to start by defining what is bioengineering, what is biomedical engineering. We have Dr. Sude Kubroy with us today. She's going to start with that. Then we'll go into what can you do in academia and research with a biomedical engineering degree, followed by what can you do in medical device support and in medicine, and then intellectual property and entrepreneurship, followed by question and answer. Feel free to type questions in the chat if you have any questions as we go, and we will try to get to those. Otherwise, I would ask that you keep your microphones and your cameras off just so we can kind of spare the bandwidth. But then when we get to the end, if you'd like to turn them on to ask questions, please feel free with that as well. Any questions before we get started, before we kind of jump in there? Once, twice? Seeing none, we'll go ahead and get going. So with that, I will welcome Dr. Kubroy, and she's going to discuss with us what is bioengineering and biomedical engineering. So welcome, Dr. Kubroy. Take it away.
Thank you. Thank you a lot. Let me share my screen then. We can start. Okay, good evening, everyone. I don't know whether you know me or remember me from the last event or not. I'm Sudha Kubroy. I'm one of the advisors of Women LLC, and I'm also a teaching faculty member at Women Department. My background is electrical engineering and neuroscience. And what I want to do today is giving you more information about bioengineering field and also our department. So most of you know that whenever we are talking about biomedical engineering, we actually talking about the using of engineering science and mathematics to tackle a problem that we have in medicine or biology. So we usually have three terms in our field that we usually use them interchangeably. One of them is biomedical engineering. The other one is bioengineering and biotechnology. If you want to know more about them in detail, I would say that biomedical engineering focuses more on medical devices. Bioengineering is more about using biological substances. And when we talk about biotechnology, we usually use living biological substances. But as I said, we usually use them interchangeably. So our major is a broad major. It's an interdisciplinary field which is related to electrical engineering, computer science, mechanics, biology, chemistry, and material science. Because of all of these connections, you actually have a variety of topics and research activities in this major. So what I want to do today is introducing some of the subfields that we have in our major so you can see what are the futures of this field, what you can actually do after a few semesters in this field of study. So I start with the first subfield, biomedical imaging. So it is a technique or process of imaging the interior of our body, and the purpose of it can be diagnosing a disease, or maybe we want to know about how an organ or tissue works in our body. So in this field, we actually have different types of medical imaging techniques, for example, X-ray, CT scan, MRI, ultrasound, PET scan, and etc. And if you join this area, you can work on improving the performance of one of these techniques, or you can even work on designing a new imaging technique. Or you can work on improving the quality of the results, because there is always room in improving the results, the quality of the results that we have, adding features to them, and etc. In addition to these tasks, some faculty and students in this field, they use imaging to learn about different functions of our body, different organs of our body, or they may use these techniques to diagnose a disease. For example, you may see a lab which focuses on Alzheimer's disease. So people in that lab, they use MRI images and compare the brain images between the healthy subjects and subjects with Alzheimer's, and see what are the differences between functional and structural images between these two groups of people. So let me move to the next subfield that we have. The next topic that we have is biomechanics. So in this area, we want to study our biological systems, especially know about the structure and function of our body. But we use those rules that we have in mechanics. If I want to be more specific, I would say that we want to focus on the effect of sources in our on our body motions. So again, you have different options here. So for example, you may join a lab and learn about the functions of our body, the effect of forces. Or you may see a lab which focuses on a specific sport, for example, a basketball, something like that, and see how it affects our body. More importantly, you can design prosthetics. Or if you don't want to work on hardware, another option that you have is working on rehabilitation of those people that use prosthetics, or those people that suffer from stroke and another disease. So you can work on that area too when you join biomechanics subfield. So let's move on to the next one. It's about tissue engineering. So in this field, what we do is combining cells, our engineering knowledge, chemistry, and etc., to restore, maintain, improve, or replace a biological tissue. So engineered tissue are important for us because compared to other alternatives, they have some advantages. For example, they have a less chance of rejection. I'm comparing it with grafting, for example. Or they are more available. For example, our patients do not need to wait for someone to donate an organ. Yes, you can also another advantage that we have for this field is that you can customize the tissue for a specific person. For example, the shape of the tissue, the size of the tissue, you can design it for a specific patient. Okay, let's move on. The next topic that I have is biomaterials. So a biomaterial is a substance that has interaction with our body. Most of the time, those materials that we have in our medical devices, for example, those devices that we have as diagnosing devices, or sometimes those that we have as implant in our body. Okay, so our biomaterials should not cause any, for example, reaction from I mean, serious reaction from our body. So biomaterials are important because our medical devices and most of the treatments are relying on choosing an appropriate material for that specific, for example, application. So what can you do in this area? So in this area, for example, you have an application and you check the different biomaterials that we have on the market, and you choose the one which is more appropriate for that application. Another option that you have is even designing a novel biomaterial based on the specifications that you need and for your own application. So let's move on to biosensors, which is another subfield of bioengineering. So biosensors are those devices that we use to detect the presence or concentration of a biological analytes. They are mainly bioelectronic devices. So we have been using some biosensors for several decades, like, for example, thermometers. But bioengineers are still working on improving biosensors in different ways, for example, size, performance, accessibility, and etc. And I would say that this is a hot area. Why? Because we are in the transition to telemedicine, and telemedicine requires us to generate sensors that work wirelessly and are as small as possible. Okay, so that's why it's a hot area here in our field. Okay, let's move to our next interesting topic, which is neural engineering. So it is another subfield of bioengineering. So what we do here is using engineering techniques to investigate the function of our nervous system, or we can even manipulate the behavior of our nervous system. So you have variety of options in this field. For example, you can use different techniques to learn about the function of a specific, for example, part of brain or nervous system. Or you can even work on designing the devices that we need in this area. For example, we can design those tiny electrodes that we need for nerve stimulation. Or another option that you have is working on treatment of some diseases because, for example, we have a strong team at UTD who they actually use nerve stimulation therapy to help patients with stroke, PTSD, depression, and etc. And they have been very successful. So this is another option that you have. Okay, this is the last subfield that we have. It's system biology. So what we do here is we look at a large picture, a system, and we want to build it by putting its smaller pieces together. So people in this area, they learn about our body and in genetic level. They can even modify, for example, genes or DNAs. And another hot topic in this area is working on curing some cancers using this technique, using, for example, gene modifications, synthetic biology, and etc. So scientists are working on this option right now. And we have at least one team at UTD. So now that I talked about different subfields, I want you to look at the website of our department. So when you go to UT Dallas website and switch to our department website, by clicking on Research tab, you can see the different subfields that we cover here in our department. We cover almost most of the subfields that I introduced to you. By clicking on each of these subfields, you have access to the list of the faculty members that work on that area. For example, these are the faculty members on in bioimaging field. If you look at the name of, if you click on the name of each of them, you will see more information about that faculty member. And most of the time, they also provide you with their lab website. So if you switch to their lab website, then you have access to information about their current and previous projects, their research interests, their publications. Even sometimes they provide you with the list of their students. So if you are interested in their projects, you may contact their students and ask more about the projects, the environment of the lab, and then finally, you can contact the PI of that lab and see if they have any research position for an undergraduate student, because they usually do. So just give it a try. And so let me show you the list of other faculty members. We have 5 faculty members in biomaterials field, 4 in biomechanics, and by the way, these are the pictures from our labs, our department. We have 2 faculty members in biosensors and bioelectronics, 2 in neural engineering, and 3 people in system biology. So I want to finish my presentation by switching back to the slide that I showed you at the beginning of my presentation. So I told you that our field is an interdisciplinary field which is related to different topics. That's why you have a variety of options in front of you. But what I said can be also scary. Why? Because if you want to be successful in this field, you actually need to have a kind of good background knowledge in all of these topics. So although you are able to switch your elective courses, your projects, your senior design project toward the area that you like more, but for the first 2 to 3 years of your study, you have to take courses in different fields. For example, about 2 courses in each of these fields. So try to put time and effort for all of these topics if you want to be a successful student in this field. Because once you finish your degree, compared to other students in other engineering fields, you have more job opportunities because of all of these connections. You have options as a bioengineer, and also, for example, you can join a company which is working on biology. Why? Because you had a research experience with, for example, animal tests during your undergrad. Or you can even join a company which needs a programmer if you're good in programming. So compared to other people, other students, you have lots of variety, but you need to put time and effort. Okay, so I think I'm done with my presentation. Thank you so much for listening. Let me know if you have any question.
Excellent. Thank you, Sude.
You're welcome.
So
Go
as she
ahead.
was saying, one of the main values for bioengineers is that you speak all those different languages basically that she was mentioning. So you speak biology, you speak programming, you speak electrical engineering. You know enough about them to be dangerous. So that's really valuable for companies because you can cross all these different fields, and that's huge. So as you'll see as we move forward with a lot of the rest of our talks, some of the main points about being a bioengineer is that you act as that spot where you can kind of give that synergy. So it's pretty cool. So we'll move forward. We'll start talking about some of that, some of what you can do. Just to reemphasize what Dr. Kubroy was saying, lab work, it's totally normal, and it's not uncommon for first year students to join labs and to work in them. In fact, we have a new faculty member who will be joining us, Kristen Miller, is going to be joining us fall, and she will be starting a lab. So she will probably be looking for volunteers to help her get that set up. Um, the other thing I want to reemphasize that Dr. Kubroy hit on at the very beginning is bioengineering versus biomedical engineering, and not the definition. Great job there, but for our department, it's a little confusing. We are the bioengineering department, but the degree we offer is biomedical engineering. So just keep those two things distinct. Know that even though we use them interchangeably, the degree that you will be earning is biomedical engineering, even though we call ourselves a bioengineering department. So, all right, good. Any questions in the meantime? We're ready to move on. Share again. And now we're going to talk a bit about what can you do with biomedical engineering degree in academia and in research. So this is going to be my area. I'll give us an introduction through this. So we're going to walk through just a list of jobs here, different areas that you can go into. We'll talk about the degree that you would need for it, the level, the median salary. So this is the salary that you would expect across the entire field. So this would be new people to it, as well as people who are more senior and have been in it for 30 years. So you're looking at that median salary that you would expect there, not the beginning salary. And we're also looking at some job growth potential. So the first one we'll talk about is going to be a high school teacher. So this is actually in a lot of high demand right now, as you would expect. You've probably heard a lot in the news about how there's a shortage for teachers, especially in Texas. But high school teachers are needed to, as many of you know, since you are high school students or recently graduated high school students, sorry. High school student teachers teach academic lessons and various skills that students will need to attend college and enter the job market. So the median salary tends to be about $62,000. It is growing. People certainly realize the need for teachers. And you only need really a BS or a BA, a Bachelor of Science, to go into this. So STEM teachers are much more needed. They usually get paid a bit more. And depending on where you're going, the only other thing you really need is that little teaching certification or the license. So in Texas, it's a license that you can apply for and you can get. So high school teachers. There's also post-secondary teachers and professors, which is what I would be considered. So that's your senior lecturers or your instructional faculty, as we're calling us now. But these are the people who go in to teach college, and their primary job is teaching. So we have a couple of different types of faculty. We talked about it a little bit last time, and we'll explore that as we move forward here. But this is the ones who focus just on teaching. So we instruct students across very varied subjects, right? So we're going to focus on bioengineering, but even that, it's pretty broad on what we go into. Your degree requirements, you can become a post-secondary teacher with a master's, but typically where you can teach other masters, or you can teach master's students, or you can teach in a community college. To teach undergraduates or doctoral level students, you need to have a PhD. The median salary is about $80,000, and that all of this does depend also on where you are. And the job outlook for that is really high, so 12%. So that is a very needed job as well. There are then tenure track or tenured faculty. This one is specific to bioengineering, I was able to find. So in addition to teaching, tenured track faculty and tenured faculty are expected to design experiments and basically further the knowledge in their given field. So they will be applying for grants, which is money that helps to support their research outside of the university. That also helps to support their salary, and they're expected that they will publish their findings in peer-reviewed journals. So they do a lot of research, but they also do a lot of writing. You do have to have a PhD for that, and you do need to gain research experience, and it's definitely good to start getting that while you're an undergraduate and build up to it. The more experience you get, the better. And then the more writing experience you get, the better too. So getting some of those publications. We have many of our undergraduates do have publications currently from the work that they're doing in labs. So the median salary for that is about 108,000, but it can go much higher, especially the more grants that you get. Job outlook was difficult to find, but bioengineering is a relatively new field, and there are many new bioengineering programs coming online. So I would say that that is definitely still a good option. Not really interested in the teaching side. There are lab manager positions. So the lab manager basically takes care of the lab, takes care of all the equipment, make sure everything's set up, that people are properly trained to use it. The tenured faculty or the people who are doing the research need lab managers basically to take care of those day-to-day tasks and keeping the lab running. The person needs to know how to use all the equipment, how to keep it properly calibrated and going. Therefore, they tend to do fairly well. So their median salary for that tends to be about 130,000. Could be pretty good. And the job outlook growth for that is 6%. And you only really need a bachelor's degree in that. You do have to have some experience to come along with it, especially usually a couple of years of experience, like years of experience. But that is definitely a path that you can follow. Master's is preferred or a doctorate, but it's something you can do with just a bachelor's and some experience. Research support, this is actually a really broad term. So if you're interested in research, but you don't necessarily want to be doing it yourself, research support using the Glassdoor definitions, making sure that all the information in the research databases are up to date and accurate. So that is one aspect of it. So you can do the kind of the data analysis, the data wrangling side. They also need people who know how to do research to help manage it. So research support can come down to how do you run it administratively through the university. So helping to support those grants. If you're on the other side and you're with the company that gives the grants, they need people who know how to do the process, who are familiar with the research, can read it and understand it so they can say, yes, this is a good experiment, we should fund that, or no, this needs some improvement. There are also jobs that are involved with the IRB, so getting approvals for doing the research on human subjects or doing it on animal subjects, making sure everything's okay with all of that, making sure there's no conflicts of interest. So there's a lot that can go into research support. This is a very broad topic. You do typically only need a bachelor's for it, but master's and PhD for some things. So if you're going into grant management or anything like that, you probably need a PhD, but there's a lot of options here as well. Research and development engineers. So this is probably what most students think of when they come in to become a biomedical engineer. This is probably what most people think that they are going to do. So R&D engineers basically do the research and development of the product on the business side. So they're not necessarily doing research, just anything that they would want to do, kind of like faculty do, but it is directed research. So you are still doing research, but it is to develop a product. So the company has identified a particular area that needs some work on it, and that's what you start going off into. So this does only require a bachelor's degree, but it also does kind of require some of that experience that you build up in the company. So you don't typically enter and go straight into research and development. You get more of an entry-level job and work your way up to it, which makes sense. You don't really want someone who's fresh out of college designing the next pacemaker. You want them to have a little bit more experience. So they might start on a part of the pacemaker, right? Something along those lines and work their way up. Median salary is pretty good on this. It's about $90,000, and the job outlook is typical. So 4% growth is our fast as normal, I think is what they refer to it. But it's your typical growth. The next step up from that is your senior research engineer. So these are the people who basically manage all those teams of engineers to develop the product. So this is a lot more management involved with this one and less of the actual designing. Degree requirement, again, it's going to be that bachelor's. Master's can be preferred. Usually it comes back and it goes more into the management side of things when you're looking for a master's. Salary on that median could be about 111,000, and it also has that typical growth of about 4%. So these are just a few of the many jobs that you can go into in academia and research. We're going to move now onto what can you do with medical device support. So we have Dr. Wanzan Liu. I think I saw you sign in. Are you here with us, Dr. Liu?
Yes, I changed my slides a little, so I'm going to share from my side.
All right, we'll turn it over to you and let you take it away. So welcome, Dr. Liu.
Thank you. Let me. Can you see my screen okay?
Yes.
All right. So my name is Wanzan Liu. So Wanzan is like H is silent. You can look up my name. That's the only name I found on LinkedIn, so you won't miss it. Feel free to connect if you like to ask questions, all that. So my personal kind of career journey, not that very interesting, but one real data point in kind of what biomedical engineer can do. So I was born and raised in China, did my high school, my hometown, and then got a bachelor degree in electrical engineer, got a master in biomedical engineering, then come all the way over to Pennsylvania, Penn State, got my PhD in biomedical engineering. After that, I thought I wanted to do research for sure. I went to University of Minnesota, did my postdoc there. After 2 years into it, figured I'm not sure if that's my thing. Joined Medtronic as a scientist, so develop implantable devices for MRI compatibility. Stayed there for 9 years, and then moved to Atlanta. Really, I enjoyed quite a bit working there, but then, the exciting development work, it's kind of done by then, become a little more routine. Also, the weather is really kind of got to me. So moved to Atlanta, still within the health medical device industry, but I wanted to get away from MRI. So it's a little bit switched from to a subfield, neuromodulation, more upfront, more research, more preclinical study, more kind of new thing. Did about 2.5 years, moved to Dallas about 3 years ago. It's really great opportunity in Abbott. They're building up a team, R&D team. So looking for a senior manager to manage and to grow that team. When I joined, we had about 4 engineers, including myself. Then, like today, I have 22 team of 22, including technicians. So we are responsible for all Abbott neuromodulation products get MI compatible. So from concept all the way to post-market support. And definitely feel free to stop me, ask any questions. Okay, I want to be interactive. So there's a lot kind of jobs going on. I kind of want to concentrate because the title is again what BME can support in medical device. So I'm gonna, this is very simplified kind of medical device life cycle, right? From the concept that you develop, manufacturing, then you launch, right? Get approval from FDA, you launch product in the United States, Europe, and globally. Then after that, you still need we call post-market. When the job device is on the market, you need to support, right? So today I'm going to just concentrate on the supporting part, because I kind of think of this as the development part of the medical device, and this is kind of mostly support part of the medical device. There's a lot of different jobs. I'll just list a couple of kind of categories here, give you some idea, flavor. Definitely feel free to ping me afterwards if I want to learn more about each one or go into a little more detail in each box. Sales rep, right? The first time you make device, you have to sell it, right? It's kind of unique for medical devices. You sell to physicians and hospitals. You can't just put on Amazon, right? So there's a lot involved. This is the biggest ticket item, meaning the company spent a lot of money to hire best sales reps and to build a relationship with hospitals and physicians. So they're very critical. They sell, basically the primary job is sell the medical devices. I have slides going to each one in more detail. So after you sold the devices to the hospital physicians, they're gonna implant, right? I'm working with the class 3, meaning implantable devices, pacemakers, deep brain stimulators that actually go into patients. That's a very complicated procedure, implant procedure. And also the education part, what kind of patients, right, can actually, should be implanted. Not every patient should be implanted with the devices. So a lot of education to physician patients have to go in. This is where clinical specialists come in. Also support during the procedure, right? When you implant a deep brain stimulation, a lot of like physicians, especially at the beginning of their career, will need some kind of help in the surgical room to, hey, make sure the device is working, right? That's like number one. Also, sometimes we need to program, meaning every patient will have different stimulation parameters, right? So a lot of times physicians actually rely on clinical specialists to kind of guide them through the process, especially at the beginning. So that's one aspect of field support. Another field support is more technical. It's called technical services specialists. Not so much in implantable medical devices, but more, say, the bigger medical devices, for example, MRI machine, right? CT machine. So they would need people go into the field, figure it out how to install, right, based on the site, then actually install the machine and then maintain them, update, and also if things broke, fix them or have them shipped back to fix them in-house. So there's a big category, technical services specialists. So then a very critical link, I don't know if people are talking about enough, is feedback, right? You have the product in the field and nothing's perfect. You're gonna have issues. People are gonna call in, complaints, all that. It's a very valuable input about this generation product, right? If you want to do a better job, you should incorporate that into next generation product design. The engineers doing that type of job, quality engineers. Maybe different companies have different names, but in my company, it's quality engineers doing that. So they would take the data, sorted it out, and then provide feedback into the requirements of the next generation product design. Then that goes back, right, next generation development, which is mainly done by R&D engineers, which I'm not gonna go into that in detail. But how I'm doing with the time? I know I got like 10 minutes.
I think you're about 5 in.
Okay, good, perfect. So sales rep. So what did they do? Sell devices to hospitals and physicians, right? And support the use of the medical devices, educate users. They actually spend a lot of time educate patients. For example, deep brain stimulation. We insert an electrode deep into the brain and leave it there for 5-10 years for people with movement disorder, for example, extreme tremor or DBS or Parkinson's disease. right? So it's a very complicated procedure. And the patients, identify patients, and then talk to patient, educate patient, right? Work with patient and physicians to make sure that's the right patient, and basically walk them through every single step along the way. And also in the OR, right? Support physician during the implant procedure, support the patient after implant, because the patient will, if you have a foreign object in your brain, you will have questions. So that's their job to kind of, hey, follow-up calls with patients, asking if you have any questions. That also sometimes they help, well, doctors in hospitals with the inventory management. So, but the business goal is really, try to sell devices to hospitals and physicians. So what they need, business acumen, because they will have like quota. They have to sell how many devices each quarter, each year. They have to have good understanding of the therapies and the products. So engineering background is definitely a plus. Excellent communication. I will have this a lot, pretty much for all the jobs I list here. It's really, I can't emphasize enough communication. Their main job is to be able to explain the very complex medical devices, right, in very simple term to patients. Think about a lot of patients, they're like, senior patients, right, 65-year-old, 70, 80 sometimes. So you'll be able to be able to explain that. And also we have lots of therapies and the products, right, and be able to tell the difference to patients and the physicians. Good at relationship building, that's kind of given. As a matter of fact, a lot of companies' revenue, right? If you ask doctors, they will have different companies, sales rep from different companies, Medtronic, Abbott, Boston Scientific in the office, right? They try to sell devices. What matters at the end of the day, because all the products are pretty good, they're pretty damn good. Really, at the end of the day, it's relationship, right? Who showed up in the OR room, who be able to explain things, who showed up when they need it most. So you have to be kind of very good at relationship building, empathy. I highlight this as really important. Sales rep job is a tough job. It's very well paid. I don't have the number, but I know they're well compensated. A lot of money goes into the hiring salary, but it's a very tough job because depends on when surgical room when they started. They have to juggle between different hospitals and call patients. They'll always have long days. So that's why empathy is very important, because see the patient, right, got treated, got the best therapy, and like for deep brain stimulation patients, the relationship with the sales rep almost lifelong, because they're always needed. That's a little bit extreme case, but for spinal cord stimulation, a little bit less. But either way, this, feel rewarded by helping out patients is really what keeps most of them going. All right, I'm gonna have to speed up a little. I just want to show you an example, like a real job post from my company on sales rep. This is associated, so it's entry level. This is for diabetes, and it's Texas, Plano. You can go into read this a lot, but maybe I just highlight a couple of things. This first one, right? You gotta be able to meet the quota. That's kind of number one business requirement. Then have all this rest. Then in terms of qualification, right? Mostly probably just bachelor degrees, minimum 1 to 3 years, and then excellent communication skills. All right, so that's a sales rep.
We may need to move on. I'm sorry.
Yep, no worries.
Okay.
Yeah. So should we stop here?
I think so. So yeah, thank you. I mean, you described most of them, I think fairly well, and you're looking at the broad overview. And I think you brought up a very good point that if anybody is interested in these jobs as we go through them, they should go look them up now. It's never too early to go see what you should be doing to prepare for your career. So it's definitely a good idea if you hear these titles in these different areas, go check them out. Like go see what the requirements are and what experiences you need to be building. So, but yes, thank you, Wanzan. I appreciate it.
Yeah, absolutely. All right, good luck, you guys. Bye.
All right, I'm going to steal the screen back. And we will talk a bit about what can you do with biomedical engineering and medicine. So, oh, okay. So one of the obvious ones that a lot of people come into biomedical engineering, and almost a third to half of the students that we walk around and we ask in the first semester what it is that you want to do with your degree, will tell us that they're pre-med. So they either want to go become a medical doctor or a dentist or a veterinarian. And that's well and good. It's definitely a good launching point from that. The degree requirements for that, you need an MD or DDS or DVM. Salaries range quite a bit. The median salary for a medical doctor generalist is about 208,000, and it goes up from there. Dentists about 163, and for the veterinarians it's about 100,000. But the job outlook is drastically different. So a medical doctor, the growth is only about 3%. If you're going for a dentist, it's 8%. And if you're looking into becoming a veterinarian, it's about 17%. So veterinarians are in surprisingly high demand. If you're not interested in becoming a doctor, but you are still interested in the medical field, there are several other good jobs, including a clinical engineer. So Wanzan referred to the clinical technicians. Those are the people who go and do a lot of things with the equipment for the company side. So they'll install it, they'll maintain it, along those lines. Clinical engineer is the person who works on the hospital side or at the clinic side. So they're the ones that are recommending to the doctors, oh, you want to do MRI? Well, here's 4 different options. Let's pick the best one, right? They're the ones who, when you get a recall from the FDA, go out and they implement it, right? So they gather the device, they fix it if they need to, or they do whatever it is needed to take care of. So your clinical engineer has to work with a lot of different people. So from doctors and nurses, especially nurses, but they also still have hands-on with the actual equipment. So they can get their hands dirty, which a lot of people like. You do only need to have a bachelor's degree in this. Median salary is about 117,000. Job outlook, I couldn't find a specific number for it, but it's good. Clinical engineers are in high demand right now. It's pretty much any hospital that you have is going to have clinical engineers. So it's a good field. Another one is a clinical research associate. So clinical research associates are the people who are responsible for actually coordinating and executing clinical trials. So for a lot of the medical devices that we talk about, especially class 2, class 3, they require clinical trials, meaning that you actually try the device out in a small subset of humans first before you're able to sell it on the market at large, and in very controlled environments. So the people who are being test subjects are safe. The clinical research associate is the person who helps to run those studies. So they're the actual boots on the ground, making sure that the people are coming in, they're getting taken care of, and all the different policies are being followed. So there's a lot of data tracking, a lot of paperwork, but it's also a lot of working with people, and it can be a good step in, or a good way to start into a bigger job. So clinical research associate, it's one of those good starter jobs, good foot in the door. The median salary is about 110,000. It does typically require some travel with it. In the job outlook, I couldn't, again, find a specific number, but I know that is another good one because medical devices, it's a booming field right now. So there are a lot of clinical studies being done, constantly needing help with them. Medical science liaison. So this is similar to the medical sales that Wanzan had referred to, but different. So medical science liaison does not actually sell the product. They're the expert about the product. They're the person that a doctor can call up and say, hey, I'm not sure how this is going to interact with this particular patient. What do you think? And they know. So it is their job to know everything about the product, to know everything about the product's competition, to keep up to date with the research that's coming out, to know all the hot topics in science. And it usually requires a PhD or an MD or a PharmD. So these require the extra training for it. Median salary is about 147,000. It is another job that usually requires some travel. And the job outlook, again, don't have that specific number, but I know it's good. So if you're interested in that PhD side, if you're interested in becoming an expert on that one topic, and still keeping up with the literature and everything like that, but not actually doing the hands-on research yourself, medical science liaison is a great option. Okay, and the last one that I'll touch on before we switch over to talking about IP law is orthotists or prosthetists. Sorry, I have a hard time with those words. But these are basically the people who design and fabricate prostheses and make sure that they fit the patients properly. So a lot of students also think that this is a field that they could go into. You do typically need a master's for this. Median salary is about 75,000, and the job outlook is, again, exceptionally high, actually about 18% growth. But also just another one of those fields that people really go into. So that's just a little bit about medicine. There's a lot more out there, but given our limited time, that's your brief introduction. All right, so our next speaker is Lance Wyatt. Technically, I can call him a doctor because he does have a doctorate. It's just a Juris Doctor. So Dr. Wyatt, Lance, I think I saw you were signed on.
I am. I'm here. Can everyone hear me?
Yes.
Very good. All right. Let me share my slides here. Here we are. Let's see how these come through.
Got it.
Got it. All right.
Looks good.
Perfect. Let me find my control here. There we go. All right. Well, first of all, Ben, thank you so much for inviting me to share about what a biomedical engineer can do in the space of intellectual property law. So it was actually 15 years ago, around this time, that I was actually getting ready to go into my biomedical engineering program. And at the time, I did not know what the term intellectual property meant. I actually didn't learn about this term until my junior year in biomedical engineering. So I'm excited that you all get to learn about it tonight. So I guess the first question really is, what is intellectual property? And intellectual property refers to creations of the mind. And some examples of what this can be are inventions, literary and artistic works, such as books, songs, etc., movies even. Symbols. So one of the most iconic symbols that is intellectual property is the Nike swoosh. There are many other symbols that can be intellectual property. Names, images, and designs used in commerce. And essentially what intellectual property is, it's a category of intangible assets. So obviously you have physical property, which can be your house, other type of physical properties, and intellectual property refers to intangible assets. So there are four basic types of intellectual property. The first are trademarks. And this refers to branding, kind of going back to that Nike swoosh. You know, companies might use trademarks to have a specific marking that relates to their name or their products. Another type that we'll probably spend more time talking about tonight is patents. And patents cover inventions. There are also trade secrets. This is confidential proprietary information. One of the most well-known trade secrets is the recipe for Coca-Cola. That is a trade secret that has been protected by Coca-Cola for hundreds of years. I don't know how long it is, but it's been a while. And then lastly is copyrights. This is original creative literary work. This can be, again, books, movies, songs, etc. Now, there are three common types of patent practices. The first type is known as patent prosecution. And what patent prosecution involves is the acquiring of a patent from the United States Patent Office for an inventor. So someone comes up with the next new and improved pacemaker, and they want a patent on their invention of that new pacemaker. They will seek someone out who can prosecute or apply on their behalf for a patent at the patent office. And this can be a very long back and forth with the patent office. Oftentimes there's some negotiations going on as to, okay, how much can you actually cover in your patent? Sometimes the patent office will say, sorry, someone's already invented what you have come up with. So there will be some kind of negotiations and changes to that patent until hopefully the patent office eventually grants a patent for that inventor. And this process, surprisingly, is not a quick process. I remember a couple of years ago watching the show Suits, and one of the characters said, we need to get a patent on this product by the end of the week. And that, of course, is Hollywood fiction. Typically, at a minimum, it takes 2 to 3 years to get a patent, and sometimes can take upwards of even 10 years to get a patent from the patent office. Another type of patent practice is patent litigation. This is generally when someone has already received a patent and they notice that someone is practicing their invention. What they will do is they will hire an attorney, a patent litigation attorney, to then sue that entity that they believe is infringing their patent. That entity who's been accused of infringement, likewise, will hire an attorney to defend them in a patent litigation suit. Finally, the third type of patent practice is transactional. And a transactional patent practice is typically going to be the buying and selling of patents. So a lot of times, a company may have a bulk of patents that they no longer are using and they want to sell and see who might be interested in buying or licensing their patents from them. So careers in intellectual property. The first category is in-house counsel. This is someone who actually works for a company and they help the company handle all of their intellectual property needs. They may help with litigation on behalf of the company. They can help with the prosecution of the intellectual property for that company. And they can also be involved in product development. Another career in IP is what's called outside counsel. And there's two specific types of outside counsel. The first type of outside counsel is what's called a patent agent. This is someone that doesn't have a law degree, but they have a technical background, such as a biomedical engineering degree, and they are able to represent someone before the patent office to get a patent if they've taken a test known as the patent bar and have passed that test that the patent office administers. We often refer to these at my law firm, Fish and Richardson, as technology specialists. And a lot of times we have probably 100 technology specialists in our firm. And what they will do is they will draft patent applications. And like I said, they don't have to have a law degree. So because they don't have a law degree, we're able to bill them out to our clients at a much lower rate than our attorneys. Which brings me to the next type of outside counsel, the patent lawyer. And patent lawyers they're going to specialize in two different types of practices. The first is going to be a patent prosecutor. Again, this is going to be someone who has a law degree and they represent clients applying for patents at the patent office. The other type of patent lawyer is what I am. I'm a patent litigator. And I actually represent clients who either have patents and they're wanting to sue someone for infringing their patent, or defending clients who have been accused of infringing someone else's patents. Finally, the last career in IP is the patent examiner. And the patent examiner is an employee of the United States Patent Office. And they are the ones who are involved in the negotiation with patent prosecutors when someone is applying for a patent. They're going to analyze the application that comes in. They're going to look at what has already been patented out there to see if this is a new and novel invention or not. So working in IP law, what is required? Well, first, an undergraduate degree, which luckily, hopefully in 4 to 5 years, all of you will have. After that, you go to law school and you get your law degree. After law school, you have to take another exam and pass the state bar. So those are the 3 essential things that are required to work in IP law. Now, what's helpful for working in IP law? Well, first, a technical degree. The reason a technical degree is important is because looking and analyzing and researching patents is highly technical. I mean, these documents, I don't know if anyone has ever read a patent. I don't advise it. They're very, very boring, very technical. But a patent is the nuts and bolts of someone's invention, and it goes into very, very discrete details of every aspect of someone's invention. So they're very, very technical. So it's very helpful to have some technical acumen to be able to understand these patents. And if you're a patent litigator, you're going to be in front of a jury potentially in a patent litigation trial, and having to explain these highly technical concepts and boil them down for a lay jury to understand is very helpful if you have a technical degree to be able to do that. Second, the patent bar that I talked about earlier. Passing the patent bar is not necessary to be a patent litigator or work in IP law, but it can be very, very helpful and make you very, very marketable when it comes to working in IP law. Now, lastly, I know we've talked some about salary. I didn't really gather much information about salary. I did a kind of a quick search to kind of see what the median salary for a patent attorney. I did find one, I think, reputable source. It was ZipRecruiter, said that the median salary for patent attorneys is $145,000. For patent examiners, they have a salary that ranges from $57,000 to $86,000. And then finally, at our firm, Fish & Richardson, for our first year associate attorneys, their salary is $215,000 for their first year. So that is the end of my presentation here. And I'm happy to answer any questions at the end.
Okay, so I apparently just accidentally hung up on the meeting, so I apologize for that. Can you all hear me now?
Yes.
I can hear you.
Okay, wow. All right, that was great. Sorry about that.
I was really
The share
concerned that
button is right next to the leave button. It's a poor placement.
I was really worried I scared you off after that presentation.
No, actually, that was really good. Thank you, Lance. That was quite good. So yes, great transition there, I guess. So next up, we have Dr. Claire Aldridge, who's going to talk with us on what I think is probably going to be one of the harder topics, but she does it quite well. She's going to talk about entrepreneurship with biomedical engineering. So Claire, I think I saw that you were excellent. All right, I'll turn it over to you.
Yes, I just joined. So first, I will make a caveat that I am on vacation, and I am in North Carolina on a kind of the start of college tours. So people a little bit behind these BME students. My daughter is 15, and we're starting to try to think about what is college going to look like. So just want to kind of, if I seem not as put together as my friend Lance, who had slides, that's because I'm in a hotel room in North Carolina. But what I want to talk to you guys about is entrepreneurship and biomedical engineering, and how your training can potentially lead to starting a new company or solving a new problem. And I think the most important part is the biomedical engineering training that you guys are going to have is going to prepare you to identify and start to think about problems that haven't been solved yet. And I think that's one of the most important things when you start to think about where you want to go. When you think about what do you want, what problems do you want to solve? Whenever I talk to students about what they want to do, I always try to focus on what are the kind of problems that you like to solve, because once you start to understand those problems, you can start to think about what jobs actually meet those needs instead of kind of doing it in the other direction, which is what job do I want? And a lot of times we think about what job do I want, and then you get in and you're like, I don't really enjoy this particular job. So the nice thing about entrepreneurship in my mind, and just a little bit of background about myself, I've been working for a little over 20 years on how do we translate science out of the laboratory and turn it into products that can actually benefit patients. And so with biomedical engineering, you have a really unique perspective in looking at problems that need to be solved, problems that require both an understanding of biology and then that practical application of engineering. How do we create something, whether it's a medical device or something from a digital perspective? How do we then create something to take advantage of the biology that we understand, the tissue engineering perhaps, and turn that into a product? And so when you think about biomedical engineering and where you might want to go, when you think about what problems you like to solve, if what you like to do is to see something and then maybe have an idea about how you might create a product that could solve that problem, then, certainly in your capstone project, for example, you might come up with something that could be the foundation of a project. So, how do you start to take the things that you've learned in your education and apply them to real world situations where you can now come up with a solution where there hasn't been one before? The other thing that's really beneficial from an entrepreneurship perspective is the idea that when you kind of are at that earliest stage of solving a problem, and whether that's a problem that is something that requires a medical device or tissue engineering or even just a new app or a new software platform, when you're at that earliest stage, you get to understand the entire breadth of the business continuum. And that's something that when you join an established company, you don't always get an opportunity to get insight into. And that insight, from my perspective, is super interesting because you get to learn about the marketing, you get to learn about the finances, you get to learn about the intellectual property. And so you get to pull all of these different pieces together and you get to start to say, how can I take all of these different components and potentially solve a problem that's in the marketplace that hasn't been solved before? So I think biomedical engineering is a place where the opportunity to start your own business, the opportunity to be part of a startup, the opportunity to go after venture capital, to have intellectual property, to file for patents for things that are your ideas. Biomedical engineering is such a great place for that because what you guys are trying to do is solve real problems in that intersection of biology and whether it's material science or digital health or um, just your straight up mechanical or electrical engineering, there is just a wealth of opportunities there. So, what I would encourage you guys to do is as you're going through your programs, is to keep your mind open about the idea of trying to solve problems and going after things and tackling things that have never been addressed before. And it can be an incredibly rewarding, also very difficult. I'm not going to lie. It is very hard work, but the idea of being able to solve a problem that hasn't been solved before is an incredibly rewarding place to be. And Ben, that's really, I don't have any slides.
That's good. No, that's
I'm
perfect. I was just unmuting
okay.
myself and say that was great. So thank you. So, and I think one of the things that we haven't really talked about through all of these, we've mentioned some salaries, but for a lot of these jobs, there are other benefits that come along with it. So as Claire was saying, the experience that you get working with a small company or a new entrepreneur, you get a ton of experience. And you get a lot of that satisfaction, and you will get people who are just Oh, I just totally forgot the word. Serial entrepreneurs, right? You just go from startup to
Yes.
startup to startup because it just kind of gives you that high that comes along with doing something that's so awesome like that.
Well, it's cutting edge. And I think the breadth of experience, right? Like when you think about if you go through that startup experience at the end of it, whether you're successful or not, because startups fail, and some startups should fail because if you're really trying to be cutting edge, sometimes it's not going to work. But you get insight into all of those different business units. So you'll get insight into the finances, into the intellectual property, into the marketing, into the manufacturing, and you might be able to understand more from a practical aspect what part of that is really interesting to you.
Definitely. And then I would also say that other things that you consider when you're looking at these jobs, experience, salary, but there's also the benefits that come with it. And that can be work-life balance can be a big part of that. If you're going to be a job that's going to have 60 hours a week as opposed to 40 hours a week, is it worth that extra $20,000 if it might be that? With entrepreneurship, you get stock options, several other jobs. So these are the things that you need to kind of think about when you're trying to pick that career path. I mean, there's a lot that goes into it. It's a difficult decision, which is why we bring it up now as you start your college career and not in your last year.
Well, and can I just sorry, Ben, but this is something I'm actually super passionate about. The most important thing is when you make a decision about which path you want to go down, it doesn't close the other paths from you. And that's part of that entrepreneurial mindset is always being able to see what opportunities are there and making a pivot. And so to always stay open to the idea that if you start down one path and interesting opportunities come that are slightly off that path, and for those of you on the call, none of you know me, but I will tell you this is a well-established fact that my career has been a mosey. And it's been incredibly interesting. And one of the reasons it's been so incredibly interesting and challenging is that I haven't closed doors when I've gone down one particular path. So I think one of the things that can sometimes seem very stressful when you're starting out on this is like, what are you kidding me? I'm supposed to make this decision right now and it's going to impact the next 40 years of my life. It doesn't. The thing is, as long as you keep going and growing and staying challenged and pursuing things that have curiosity for you and are challenging questions that you're interested in, you can always move into other areas. So don't ever think that just because you went down one path, you closed a door to another.
Absolutely. And of the 5 speakers that we've had tonight, including myself, I know at least 4 of them have had very crooked paths or meandering. I think that might be the word.
We prefer Mosey. No Mosey.
Mosey, I like
Mosey.
Mosey.
We're
Mosey
very
is good.
Texas.
Mosey is good.
It's a Texas feel,
It
right? Like
does.
you can
Yeah.
imagine that armadillo on his Mosey.
Yeah, but definitely don't feel like you have to pick something and stick with it for the rest of your life now. Things change for sure. Well, that basically wraps up the presentation parts that we had for tonight. We have presented a lot of options to you. You don't have to make up your mind now. Part of the reason that we present all the options to you, or at least a good chunk of them, is so you can start thinking about it now. You can start thinking about what it is that you like to do. What is it that you're good at? What is it that you excel at? What is it that you could spend hours doing and not notice the time go by? Start paying attention to that throughout your academic career and let that help define where you want to go. Don't wait until the last semester and say, oh, geez, I got to get a job now. That's too late. You need to start thinking about it now. So that wraps up what I have. I will reemphasize those 2 upcoming events before we completely go for questions. So that was, again, the Summer Welcome Series. We have our last official event on August 10th. That will be virtual again. That's where we go over the different resources that are on campus. And then on August 19th is going to be our College Prep Boot Camp. That will be in person. That is the Friday before school starts. So hopefully you'll already be on campus or local. We'll provide lunch for that, and we'll have t-shirts for everyone. And that is, again, to get you ready for all those college skills that you should hopefully have coming in to make sure that you are ready and just can hit the ground running. So,
all right, Ben, those of us who've been on this call, do we get t-shirts too?
Absolutely. Next time for sure. Yeah, I'll get you a shirt. Are there any questions from anybody who's attending? Either you can type it in the chat, you can unmute yourself, however you want to do it. I think we have a couple of our speakers still left. Or no, how long do we wait? Yep. Well, in that case, I'm going to stop recording. I'll hang around for a few more minutes in case we do have any other questions, but that'll bring us to an end for tonight. So thank you all for coming. Look forward to seeing you on the 10th and then in person when school starts. And thank you again to all of our speakers. We appreciate you joining us.